So good, so good, so good.
New summer arrivals are at Nordstrom Rack stores now. Get ready to save big with up to 60% off brands like Rag & Bone, Levi's, Adidas, and Free People. Join the Nordy Club to unlock exclusive discounts, shop new arrivals first, and more. Plus, buy online and pick up at your favorite Rack store for free. Great brands, great prices. That's why you Rack.
You're in your apartment alone. Then you hear something. You think, was it just the storm? You realize you're not alone. Your living room is not safe with Unhinged, the new immersive game experience brought to you by Netflix. To make it out alive, you must answer the phone. The question is, when your phone rings, will you answer? Tap the banner to play Unhinged now, only on Netflix.
Hey everyone, Chris here from MedPrep2Go, and welcome to another episode of our USMLE Step 2 Questions podcast. In this episode, I'll be reading 3 more GI questions from our online Qbank, and of course, you can read these questions and more at medprep2go.com. And with that being said, let's get started with question 1, Gastrointestinal 19. A 50-year-old woman presents to the clinic with a 6-month history of episodic flushing, diarrhea, and unintentional weight loss. She also reports a sensation of pounding in her chest and neck, especially during these episodes. Her medical history includes well-controlled hypertension and type 2 diabetes. She takes lisinopril and metformin. Her temperature is 37.5 degrees Celsius or 99.5 degrees Fahrenheit. Her blood pressure is 130/80, pulse is 100 beats per minute, and respirations are 18 per minute. On physical examination, cardiac auscultation reveals a systolic murmur best heard at the lower left sternal border that increases with inspiration. Laboratory results show the following: a hemoglobin of 12.0 grams per deciliter, leukocytes 8,500, platelets 250,000, 24-hour urinary 5-hydroxyandolic acid 5-HIAA is elevated. Which of the following is the most appropriate initial treatment for this patient's condition? Is it A, azathioprine, B, infliximab, C, octreotide, D, prednisone, or E, surgical resection? And the correct answer is C, octreotide. The patient's presentation of episodic flushing, diarrhea, weight loss, and elevated 24-hour urinary 5-HIAA is consistent with carcinoid syndrome. Octreotide, a somatostatin analog, is the treatment of choice for symptomatic relief and control of carcinoid syndrome by inhibiting the release of serotonin and other vasoactive substances from the tumor. Answer choice A, azathioprine, is incorrect. Azathioprine is an immunosuppressant used for inflammatory bowel disease and other inflammatory conditions, not for carcinoid syndrome. Answer choice B, infliximab, is incorrect. Infliximab is a tumor necrosis factor, TNF, inhibitor used for inflammatory conditions like Crohn's disease and rheumatoid arthritis, not for carcinoid syndrome. Answer choice D, prednisone, is incorrect. Prednisone is a corticosteroid used for various inflammatory and autoimmune conditions, but is not a recommended treatment for carcinoid syndrome. Answer choice E, surgical resection, is incorrect. Surgical resection may be indicated for localized carcinoid tumors, but octreotide is the initial treatment for symptomatic control in metastatic or unresectable disease. Key learning point: in patients with carcinoid syndrome characterized by episodic flushing, diarrhea, weight loss, and an elevated 24-hour urinary 5-HIAA, the most appropriate initial treatment is octreotide, a somatostatin analog that controls symptoms by inhibiting the release of serotonin and other vasoactive substances. Question 2, Gastrointestinal 20. A 52-year-old man presents to the clinic with a 3-month history of diarrhea, abdominal pain, and significant weight loss. He describes his stools as bulky, foul-smelling, and often associated with flatulence. He also reports joint pain and a persistent cough. Past medical history is negative, and he does not take any medications. Vital signs are within normal limits. On physical examination, there is generalized lymphadenopathy, hyperpigmentation of the skin, and a dystolic murmur at the right upper sternal border. Laboratory results show the following: hemoglobin 10.5, leukocytes 11,000, platelets 290,000, and an ESR of 70. Small bowel biopsy reveals villus atrophy and numerous periodic acid shift positive macrophages in the lamina propria. Which of the following is the most appropriate initial treatment for this patient's condition? Is it A, azathioprine, B, metronidazole, C, penicillin, D, prednisone, or E, sulfasalazine? And the correct answer is C, penicillin. The patient's presentation of diarrhea, abdominal pain, weight loss, joint pain, cough, generalized lymphadenopathy, skin hyperpigmentation, and a dystolic murmur along with small bowel biopsy findings of villus atrophy and numerous PAS-positive macrophages is consistent with Whipple disease. Whipple disease is caused by the bacterium Trophorema whipplae. The appropriate initial treatment involves antibiotics such as penicillin. Answer choice A, azathioprine, is incorrect. Azathioprine is an immunosuppressant used for autoimmune conditions but is not indicated for treating Whipple disease. Answer choice B, metronidazole, is incorrect. Metronidazole is an antibiotic but is not the first-line treatment for Whipple disease. Answer choice D, prednisone, is incorrect. Prednisone is a corticosteroid used for various inflammatory conditions but is not appropriate for treating Whipple disease. Answer choice E, sulfasalazine, is incorrect. Sulfasalazine is used for treating inflammatory bowel disease, but is not effective for treating Whipple disease. Key learning point. Whipple disease presents with symptoms such as diarrhea, weight loss, joint pain, cough, generalized lymphadenopathy, and small bowel biopsy shows villus atrophy with PAS-positive macrophages. The appropriate initial treatment is ceftriaxone or penicillin, which are known to penetrate the blood-brain barrier, followed by maintenance therapy with oral trimethoprim sulfamethoxazole for 12 months.
Experience a membership that backs what you're building with American Express Business Platinum. Enjoy complimentary access to the American Express Global Lounge Collection and apply to find out your welcome offer, which could be as high as 300,000 membership rewards points. American Express Business Platinum. There's nothing like it. Terms apply. Welcome offers vary and you may not be eligible for an offer. Learn more at americanexpress.com/business-platinum.
Tomorrow morning is knocking. Stock your fridge now. How about a creamy mocha frappuccino drink? Or a sweet vanilla? Smooth caramel maybe? Or a white chocolate mocha? Whichever you choose, delicious coffee awaits. Find Starbucks Frappuccino drinks wherever you buy your groceries.
Question 3, Gastrointestinal 21. A 42-year-old woman presents to the emergency department with a 3-day history of fever, abdominal discomfort, and fatigue. She has a history of membranous nephropathy, and her current medications include prednisone and enalapril. She has no history of cirrhosis. She does not smoke cigarettes or use alcohol. Vital signs are temperature of 38.8 degrees Celsius or 101.8 degrees Fahrenheit, blood pressure of 102/64, heart rate of 110 beats per minute, and respirations of 18 per minute. On physical examination, there is moderate abdominal distension, but no rebound, tenderness, or guarding. Her lower extremities are edematous. Laboratory results are as follows. Serum albumin 2.0, urine protein 8.5, white blood cell count 14,000, blood cultures are pending. A diagnostic paracentesis is performed, revealing acidic fluid appearance is cloudy, PMN count of 350 cells, gram stain, no organisms identified. Which of the following is the most appropriate next step in management? Is it A, begin oral ciprofloxacin as prophylaxis, B, increase the dose of prednisone, C, monitor the patient closely with serial abdominal examinations, D, perform an abdominal CT to evaluate for intra-abdominal pathology, or E, start ceftriaxone intravenously? And the correct answer is E, start ceftriaxone intravenously. This patient with nephrotic syndrome and fever is at risk for spontaneous bacterial peritonitis, SBP, due to a combination of factors including loss of immunoglobulins and complement in urine and ascites formation secondary to hypoalbuminemia. The ascites fluid analysis confirms SBP with a PMN count greater than or equal to 250 cells, even in the absence of organisms on gram stain. Empiric antibiotic therapy with a third-generation cephalosporin is indicated immediately. Answer choice A, Begin oral ciprofloxacin as prophylaxis is incorrect. Antibiotic prophylaxis is used to prevent SBP in the high-risk patients but is not appropriate for acute management. Answer choice B, increase the dose of prednisone, is incorrect. Prednisone is not indicated for acute infection and may worsen the immune compromise. Answer choice C, monitor the patient closely with serial abdominal examinations, is incorrect. Delaying treatment in a febrile patient with nephrotic syndrome and acetic fluid PMN count greater than 250 cells is inappropriate and increases mortality risk. Answer choice D, perform an abdominal CT scan, is incorrect. Imaging may be considered if secondary peritonitis is suspected, but this patient does not show signs of peritonitis such as guarding or rebound tenderness. Key learning point. In patients with nephrotic syndrome and fever, prompt evaluation and empiric antibiotics for spontaneous bacterial peritonitis are critical, even in the absence of cirrhosis. And that will conclude this episode of our USMLE Step 2 Questions podcast. I hope you enjoyed it and found the information useful. Please be sure to follow us at MedPrep2Go on Facebook, Instagram, LinkedIn, and YouTube to stay up to date with our content. You can learn more and read other Step 2 questions at medprep2go.com. Happy studying!
There are two types of business owners, those who are busy and those who want to be busy. Toast is designed for both, with tools to keep you humming and help turn grind into growth. That's how you turn busy into business. Toast, built for busy.
Uncovered windows can make your home feel up to 20 degrees hotter. Stay cool and save up to 50% off custom window treatments during the 4th of July mega sale at Blinds.com. From outdoor shades to room darkening blinds, finding the perfect fit is easy. Get free samples, expert design help, and professional measure and install services. Or DIY with confidence and support every step of the way. Shop up to 50% off site-wide, plus huge savings on doorbusters right now during the 4th of July mega sale at Blinds.com.